and a speaker, Dr. Pradeep V Mahajan. Sir has been on the show in the past. Let me give you a small brief about Sir before we start the show. Dr. Pradeep Mahajan is a distinguished diplomat certified by the American Board of Regenerative Medicine and a member of the American Society of the Regenerative Medicine. He serves as an adjunct assistant professor of surgery at Indiana University and holds an honorary professorship at Turner Medical College. Sir is a visiting consultant at Kokilaben Dhirubhai Ambani Hospital and Medicover Hospitals in Navi Mumbai. He is a distinguished associate of regenerative medicine and CBT at Cooper Hospital and a scientific researcher and investigator at STEM Medica in California. His expertise extends to stem cell therapy, having earned certification from Ohio State University. Dr. Mahajan is also a visiting faculty at Wexner Medical Center and a visiting speaker at both national and international conferences. Notably, he has been appointed as a committee member for the stem cell guideline draft for the Government of India and holds national and international patents related to avascular necrosis and many more. Thank you so much, sir, for coming back on our show. Like I said, it's always a pleasure to have you on our show. Abundant knowledge, a lot of experience that you shared last time. We had so much appreciation from all our audiences, and today we are back with another show and another topic, which is post-COVID complications. So, sir, talking about COVID, I think, COVID being a pandemic, I think everybody knows what COVID was like and what COVID did. And it was very recently when people started relaxing that COVID is no more a pandemic, it is the end of a pandemic, and people started getting back to their regular jobs. But it was surprising and shocking when people started developing some newer symptoms, and it was not just one or two, but most of them who had a prior COVID infection started coming out with these symptoms, and that is when the whole concept of this post COVID complication started with. So, can you please explain with your expertise what exactly are these post COVID complications and why is it an important topic in healthcare?
Dr. Virenchi, you have touched a very sensitive subject of today. Very sensitive. I'm thankful for you to bring this subject today. Reason being that COVID was a very dark period of the human generation of this century. I would say rather of this entire century, which has changed the entire dynamics of medicine, entire dynamics of not only economics, entire dynamics of relationships, business, everything was changed. Nobody knew what will happen during the COVID period and after the COVID period. Nobody knew. These are all speculations, hypotheses, and predictions. People also changed the guidelines of their own lifestyle, business, economics. There were so many stories came in that everything after COVID will be changing. But remember one thing, life has a cycle. Life is a cycle. You cannot die before your death comes. You cannot die before your death comes. If you want to die, you cannot die. COVID has taught you a big lesson. People who were supposed to live, they did. People supposed to who were died, they survived. Good known top scientists, top doctors, top politician, bureaucrat, everything lost their life, hoping that they are the king. They were thinking they were the kings of the world. COVID has made the change, and nobody knew what will happen after the COVID. During that period, what you and me are sitting here has come up as an evolution. That digital platform became a prominent platform to reach to the people because their communication gap, people wanted to have distances and reach to the people. That was the only media by which you could do. So what happened? This COVID, those symptomatology, the disease pathology, progression, and the way outcomes were there were so much changing. We did not have drugs. We did not have diagnostic profile. We did not have approach how to go ahead. We never knew anything can happen. But it went through a stage in 2-3 cycles of 2-3 years. And we learned out big lessons. Till another 5 years or 10 years, I would say rather, we will still not know what kind of post-COVID presentations will change. Diseases will change. Presentations will change. The old diseases, their presentations will change. And still we are finding that. We are finding that what's happening now. Because the inflammatory cycle or a catastrophic movement of this inflammation took place, they will remain in the body for remnant for years together. Not only that, we brought in vaccines. They were also, what is a vaccine? It's a denatured protein of the same virus. That's all. We brought in synthetic RNA vaccines. We brought in synthetic RNA vaccines. We did a repurposing of medicines. And today we have multiple repurposed medicines. Then we were finding difficult because we did not have any choices. We were just trying. Now remember what has come out as a post-COVID, what you asked a question to me, is a big challenging situation because it has affected your neurological system. It has affected cardiac system. It will affect your respiratory system. It will affect your skeletal MSK systems. It has affected your GIT. And wonderful part, people may not know, it has affected your fertility system. And the effects of such kind of chronic disease will know over a period of 10, 20 years post-COVID. And we are in that frame of life now. Now, if you see, I see so many different vague presentations. I have seen young guys getting cardiac problems, young person who doesn't have any come with the respiratory problems, patient with neurological problems, ophthalmic problems, psychiatric problems. You are a psychiatrist. Hope you are getting some of the COVID patients having depressions very common.
True.
Depression is very common. Now, all these a bucket of gift of COVID to the world to find out new solutions, new disease pattern. So disease pattern is completely changed now. So from my experience, COVID has taught every lesson for us. Every lesson for us. Those people who are finding life as a survival story is different. But if you analyze and go back to understand about the disease pathophysiology, how it's affected all the body, we understand it is a big, painful gift to the human mankind. You will find in every system this happening, every system of the body. And I have worked during the COVID a lot to work on finding how we could deal the disease from a protective response to the treatment response to the outcome response. Protective response is a protection where we wanted to avoid the COVID infection. That was a principle and which today even the world agrees what India has given to the world that time. Even the most advanced countries today follow Indian philosophy of protection of COVID by distance keeping, by using masks. Those are the primary steps where you could have done that time because nobody believed it, and today we learn the lesson. So I believe, Virenchi, we need to understand the disease profile, which is going to change still more ahead. It's still more going to change, trust me.
Right.
You will find a huge number of even psychiatric patient, infertility patient, cardiac patient, respiratory patients. All of them are a gift for the community.
I think very wonderfully said, sir, because, most of the audiences only knew the COVID affecting the lungs, but you spoke about how the different systems are being affected.
Yes,
sir,
lung is a very small part of it, I'll tell you rather.
Right. So, sir, like you said, since there are many other systems that are getting affected, in your expertise and your experience, what are the common complications that you have seen, and how different are these compared to an active COVID infection?
See, active COVID infection is an active inflammatory process in the body. Now, it could be a short or it could be a long time of the inflammation. I have seen the patients who have been on 30 days, 40 days on ventilator, they have come back and they don't have any complication of the lung also. I have seen patients who were not on a ventilator, had a small pneumonic patches, and today they have a huge fibrosis of the lung. I have seen patients who have not been hospital for hospitalization, but they manage their COVID at home, but they are coming with a depression. I have seen patients who have lost their, physical responses to the diseases that time. Today, they are carrying the same symptoms future in the life. So I am finding various class of patients from visual aspects, respiratory aspects, auditory aspects, neurological aspect, GI tract aspect, cardiac aspect, skin aspect, muscular problem, huge today even, huge muscular problem. Out of all these drug complications are more again. What we have used is steroids, Remicade, and what we have not used. All that led to a further bone and musculoskeletal complications like avascular necrosis, osteoporosis, myalgias, muscular pains. These are all problems today. We never had this kind of disease. So COVID has not given also give all of us. This I see all the patients in my life. I'm laughing, but we have to be true to accept the pains.
Correct.
Very and true. We have to be readily present with our armaments how to deal these things.
Very
true. Journey now. We are learning through the processes, and I believe respiratory tract was a source of infection only for the reason. Always when I give a talk on COVID, I ask people, you and me are breathing 24/7. We have bacteria in our lungs, trillions of virus in the lungs. Why everybody doesn't get the infection of virus in lungs? Why? Big question mark. You had a bad lung, did COVID, but you recovered 100%. Some of them had a small infection, but had a bad disease of the lung. So we need to understand relationship between the diseases coming to us and our body profile, our immune profile, how we tackled. So a lot of solutions will come if huge research is happening. So why this happened, why this is not happening, all solutions will come. From my experience, I say, it has not left any system of the body affected.
Right.
That's the effects you will see another 10, 15 years. A generation will go in this.
Right. I think you very clearly explained about the variety of the dimensions, the way it spread all over the body, and you even spoke about the challenges that we are facing, because we all thought it was confined to one area, but now it isn't that way. So, sir, in such a situation, how do we as healthcare professionals prepare ourselves, in understanding the management of these complications or identification of these complications, and how do we go ahead?
Dr. Virenchi, the concept as a health service providers, we need to touch the basic pathophysiology of the disease, understand the progression, what are the effects of this inflammation will affect various molecular level changes taking place from the nuclear to the cytoplasmic changes, which may not affect today, will affect over a period of time. You will find increasing mutational changes. You will find extra matrix changes, which will affect the tissue regeneration also.
Right.
You will see molecular changes affecting the functions of the organs also.
Right.
Recently, you might have heard patients coming with a myalgic pain throughout your body continuously
Correct.
with they are taking some steroid or some painkiller, and again it comes back. And what is how many are happening at that level? Can you forget vasculitis, endothelial inflammations? Very sensitive, very painful. And remember one thing, when there's an endothelial inflammation in the capillaries or venules, your nerves are also affected. The pain is simultaneous gift. So we as a healthcare providers has to understand, because though active phase is gone, but the remnants which have been given to our body cannot change. This virus, we may be saying is gone. No, it has not gone. It will
Right.
still come in a small forms. Keep on coming, and it will remain lifetime gift to you like an influenza.
Right.
It will remain lifetime. But
Right.
that is the reason I say is symptomatology and disease pattern of the COVID will never ever will go away for at least another 1 century. So
Right.
we as a healthcare provider, we need to focus these pathophysiological changes, affection of the systems, and put in our protocols how to deal with them.
Right. But
We have to increase our literature work of repurposing of medicines, various therapies, and various new molecules. In change in the lifestyle is mandatory. You cannot live the same life today. Those who are living with the same life today, past COVID, they still will face a lot of health issues. They'll
right.
face health issues. Considering that it is gone. No, it's not gone. As a health physician, we need to change our approach to the patients.
Thank you. Thank you so much, sir, because you've given a very beautiful answer about how we as healthcare professionals should change our whole perspective about treating a condition after the whole pandemic. Sir,
Yeah.
you spoke about how we as individual practitioners should be preparing ourselves. What do you think is the kind of impact the post COVID complications are having on institutions or on hospitals?
It's an pattern of protocol designing, systems designing, considering a separate from a standard medical care. If you as a physician, if you are part of organization has to plan out. Every patient comes to you, don't treat as if the disease presentation related to that disease, because disease has been influenced by the COVID inflammation in lot of areas. So you consider that as a part of this presentation and change your approach to the disease. The institutions has to change the protocols, change the approach to the patient to see the outcomes are changing. You may have symptomatic relief. If you want to just treat them, no, there's a body ache, give him painkiller, give him steroid, give him this. But that you could do always earlier. But that's not the treatment today. You understood? Because there is some pathology is lying there and you are treating symptoms. The patient will lie in a different complications. So hospitals need to plan out changing the protocols and find out the relationship between the current symptoms and the COVID added symptoms, COVID added pathophysiology. And then you treat the patient. So I would like to say, please go into details of symptomatology, evaluation at molecular level, establish the correlations, and design the personalized, customized treatments. So I would rather every patient you need to treat as in precision way, Find out. Don't treat symptoms and send the patient at home. You will send it, but under 10 days, he will again problem. After 50 days, 100 days, again he will have a problem. So go to the root cause of happening, treat the pathophysical changes taken place because the symptoms are coming now. Fibrotic lesions are there, inflammatory chronic lesions are there. All these are the gift. Endothelitis is very high seen in many of the patient, cardiac patient, lung patient. They are seeing is endothelial inflammation at a very high level. Estimate that occurs. Look into that profiles and work out a separate design treatment for them. So we have to extend our platform of diseases, treatment of the disease beyond symptomatic treatment by using other technologies of regenerative medicine, peptides, growth factors, energy medicine. They will add some permanent relief to the patient so that you can bring the patient permanently out of the disease pattern. And I, at my center, have designed a lot of post-COVID protocols.
Wow.
Lot of them. You come with me for a worst myalgic pain, I will see that it's gone permanently. You have to design depending on pathology, like neurological depressions. You can do wonderful treatments. They can come out of this problem. The response of respiratory disease. Recently, I have launched one trial I'm going on today. Is a phase 2 trial for lung and lung disorders, active COVID and post-COVID. If you ask me one more question, Doc, what have done a wonderful work for post-COVID patient? Have you contributed something? I'll tell you what I have contributed.
Well, we would love to know that, sir. I mean, if you don't mind, if I can ask that question as the next question, because, in the previous question, you clearly answered about how we as healthcare professionals should change our approach right
Very
from the
important.
history taking level, because
Very important. History
need
taking has
to-
become a very, very detailed subject now.
right.
We avoid it. And we avoid it. Health professional should re-go back their history taking systems as per Hutchinson has taught us.
Correct, sir.
How small points important. They give a clue. What is this reason? Why did this happen? If you go to the history taking back to our student life, I think your approach will change. You will get the disease reason.
So true, sir. So true. But yes, sir, we are very excited to actually know because someone like you who is very much interested in molecular medicine as well as working with the stem cell, what is the research that you have been involved with, and we would very humbly like to ask you the contributions from your end, research as well as through experience.
Thank you, Renchi. You have touched my heart, honestly speaking, because I focus on those patterns very closely, monitoring them and work upon them. I always used to think a very big question in my mind. You and me breathe 24/7, whether you're awake or you're sleeping. Everyone in the world, right? And
Yes.
this breathing is subconscious breathing. Knowingly that there are trillions of viruses in the air, which are always bombarded from the space. There are trillions of microbiomes. Today, with the industrial type of life we live, trillions of heavy metals, chemicals, poisons. Don't you think we are inhaling? Yes, no.
Absolutely, absolutely.
Then why all of now are getting lung infections? If I put same number of viruses, bacterium, heavy metals in other organs of the body, what will happen to those organs? Can you just analyze what will happen to those organs?
They would start getting damaged.
Then what is that miracle in the lung? Why it doesn't get damaged so often? Have you ever thought of it? This was a question in my mind. Why I'm breathing every moment? I'm taking trillions of viruses. Nothing happens to my lung. Who is protecting my lung? It's a big question mark.
True.
But remember, 2019 end and mid 20s, A huge research was happening on this with the COVID coming into picture. And if I ask you one simple question as a physician, you and me, we have learned very intelligent subject of medicine for 10 years. We have been taught respiratory system so thoroughly. Hematopoietic system, we have been taught very thoroughly, right?
Correct.
Even if you ask to the gathering of all the doctors of the world, ask them a question, where the platelets are produced, manufactured in the body. 99.9% people will answer they are in the bone
Correct.
marrow. Some may add spleen, some may add liver, right?
Correct, sir.
Some of them may add, but most of them add bone marrow.
True.
If I say it's wrong, what is your opinion?
This is very new, sir. I mean,
If I say no, it's wrong. My work and my research says 80% of your platelets are produced in the lungs and 20% in the bone marrow and spleen. Will you believe?
this is, again, like I said, something absolutely new to me.
So this is a science dynamic which is changing every moment.
Wow.
COVID had taught us this. This lesson would have not come existing if COVID was not there.
Right.
We've not gone to the details. So time has come to rewrite the textbooks now. 80% of your platelets are shaded from megakaryocytes and proplatelets in the lung. And that too, how you do know the beauty of it, again, I'll tell you. It's a sharing force. Sharing force. How the resistance works in the capillary flow, shears the force of flow, change in the flow rate, shades the capillary platelets in the lung. Is it a beautiful theory?
Absolutely. Absolutely.
Beautiful theory. Now you breathe more, platelets are more in the lung. You do breathing exercises, platelets are more in the lung.
Right. Right.
It's a something dynamics, and that's how I worked on this research so hard, and I came out the concept of the growth factors from alpha granules of the platelets are protecting you.
Wow.
No one else. You breathe 24 hours, sharing force is there, platelets are getting along the bifurcations of the capillaries, they get a heat up there, they shade the near platelets from the platelet side. That's a beautiful journey. Sigmosign 1 is another molecule which helps the platelet to produce more proplatelets and more platelets in the lung. So that is how my research has come out, and I have come with the concept of lyophilization of the platelet by decanting the cytoskeleton of the cell, bring the growth factor platelets, lyophilize them as a granule powder, and inhale the lungs. Put them continuously. Your fibrosis will go, your inflammations will go, and disease will go. What I have done, a natural pattern of healing process, the lung I have converted by changing a pharmacological system, by changing a physiological system of the body into pharmacological system. Same. Wow. So you need a very conceptual idea in the brain and work it and see the results will come. Wonderful. This is my research which I have done, and I am going in a phase 2 trial now. I have proved allogenic xenograft platelets safe in the animal model, and now phase 2 trial for human model I have started.
Wow. Thank you, sir. Thank you
Paper
for.
I'm planning to launch for lung problems post-COVID.
Wow. This is a very big information that you have shared on our platform, and we feel very proud about this, sir. That we could get this information on our platform. But firstly, very proud, sir, and super congratulations to all the work that you are doing, because I know you're a very busy practitioner. I know you're a very busy researcher, but the depth that you spoke about right now is, you made many medical professionals think from a very different angle in few minutes. You suddenly, I think activated a lot of neurons. I know my neurons are firing now.
Thank
Thank
you.
you.
Thank you. See,
Thank you so
science
much.
is wonderful, I'll tell you. It's dynamic. Every day it's changing. What I might have done 6 months before, I don't do today. If I done something today, I'll do something tomorrow different.
Correct, sir.
Something gives me instinct feeling, no, this doesn't work. Let's work upon these natural protocols which are happening in the body, convert it into therapeutic protocols.
Sir, we just lost you for a few seconds. Are you able to
Now I'm
hear me,
there.
sir? Oh, yes, yes, yes.
I
You're
can
right
hear
here,
you. I
sir.
can hear
Right
you.
here. Yes. So, since you spoke about research, we would like to hear it from you, in regards to the kind of research that's happening in regards to the post-COVID complications.
Yes.
Is there material that doctors or individuals can read and understand that all of this could be a part of their COVID sequelae?
In fact, I can give a lot of literature published from my side also, articles published from
Wow.
my side also. I can give some research publications from my side also, particularly of my work, which is working on platelet. Wonderful, Virenchi, I'll tell you, beauty of that. In the textbook, even today, we know role of homeostasis, only clotting factor role, homeostasis, right?
Right.
That is only 10%. It has a more function than this. Very small function. For your information, a small platelet, which is a discoid cell having no nucleus, produces 120 cytokines given at a time. How much? 120
Wow.
given in the microenvironment. And they are the one which I work on a huge on them to take to the clinical side now. So I think there's a lot of research happening. Energy medicine is playing a major role. Energy medicine. I use the technologies by which the capillaries can burst and produce more of a platelets so that healing takes place. I use the technology of microcurrents, particularly those foggy brains. 10 to 15 sessions in one shot of my growth factor or exosomes, and the foggy brain will disappear permanently in the life. Permanent in the life. So I work on a technology of microcurrents, which is researched recently, to target those areas of the brain where the inflammatory chronic reactions are still pursuing to change the microenvironment. I use done magnetic resonance technology. I use a technology of high pressure waves, very intense pulse pressure waves. I use a technology which is called, which recently has come, photomodulation. I use a technology with neuropeptides, which play a major role on immunomodulation, which is a basic cause of COVID again.
Correct.
You can change the environment. So these researches I do in my lab at my place and translate them on the clinical side. So my program for post-COVID symptoms is so much beautifully designed. Let the patient come with any symptom of post-COVID. from lung fibrosis, auditory problem, visual problem, tiredness problem, foggy brain, myalgic brain, sclerosis of the bone, arthritis of the bone, necrosis of the bone, everything is treatable. But only thing you have to use your research activity, more depth of it, like molecular cells. What has taken, let us reverse back.
Right.
Because COVID has gone now. It are the remnants. The remnants. And these are going to be gift for us. So we have to work on these kind of modules now, in which I'm working at STEMRX, and we are getting very good results. I'm very happy. I'm coming out of wonderful solutions for the worst things, which I call, world may call unmet need. They may give painkillers. I don't give painkillers. They may give steroid. I don't give steroids.
That's great. That's wonderful, sir. I think again this is a lot of good news to people who are watching, because you're talking about finding treatments without using those conventional methods where we
You
know.
don't have to use, because they will need again the same symptom again and again.
Right.
We need to change the pattern of pathological disease has taken place there.
Right. So talking about COVID, even when there was the active pandemic and active infection spreading around, the major fear was always about the two extreme populations, the pediatric population and the geriatric population. Uh, Now, coming to these post-COVID complications, is it again any different for different age groups? And is there something that we should be concerned about if someone in the pediatric or the geriatric age group had an active COVID infection? So, what are those warning signs that we should be looking for?
Dr. Virenchi, it's very important. Definitely, the clinical presentations were different at different ages because the immune systems were different.
Right.
Because the body response was different.
Right.
I think body response, the immune system is still immature. Adult matured immune system plus the body response was different. Aging, again, immune system is compromised. Body response were different. Vascularity was different. Tissue profile is different. Above 40 years, there's a lot of inflammatory profile in the human body. Senescent cells increase, inflammatory molecules increase. The response is different. So keeping these things in the mind, we have to keep these things in the mind. If the disease presentation are different, the profile of disease will be different, symptomatology will be different, pattern of management will be different. Though the pathophysiology is also different because the systems were differently affected. So we need to work upon that. So don't just treat them with the symptomatic treatment. So we need to work on separate platform. I cannot treat the platform of a chemical molecule of pharmacological drug, which treats only signs and symptoms of the disease. But the milieu below is changing. Disease milieu is changing. I'm not bothered for that. And I'm treating the symptoms. Got it, Virendra?
Correct. Absolutely.
This will come with a double profile.
True.
Double profile. Now we need to change what has gone wrong in that pathological disease here. So
Right.
work on that. So your approach has to change when you are treating an elderly patient, pediatric patient, or an average middle-aged patient. Even male and female also, I would say rather. Even fertility issues also, I tell you. I hope you could get to the people this message.
Absolutely, sir. Absolutely. I think we very specifically spoke about how it depends on what the previous infection was and what the current status of the person is and what the presentation is like. Sir, again coming back to the times when the pandemic was going on, I remember a lot of health experts coming onto different podiums, and they spoke about how preventive measures should be taken. What are all the different interventions and measures that an individual should be taking care of? But again, now, once the COVID pandemic has ended, people have gone back into their busy lifestyles. But now this, post-COVID sequelae is rising, and a lot of our audiences want to understand what are these preventive measures and interventions that an individual should take to avoid or reduce the complications of the COVID-19 sequelae.
Oh, Ranjit, this is a very good question. Very good question. Rather, how do we prevent these post-COVID complications, one, or how do we reduce these complications in the intensity rather? Yes, we need to change the lifestyle, first of all. First of all, I would say change the lifestyle. Approach to the life has to be changed. Try to put yourself in a framework, knowingly that you are affected, you are suffered with ABCD disease, there's a remnant in my body. You can't go with the same philosophy of taking the same medication and same lifestyle. So lifestyle change is the most important. Your dietary pattern has to be changed. Your communication programs are to be understood. What is the main reason why the disease is spread out more, why we can limit it, how we can limit it, how we can reduce your symptoms by various rehab programs, various immunomodulations, anti-inflammatory diets, a sound sleep, keeping the body milieu at physiological level, maintain the alkalinity of the body, maintain the good microbiome of the intestine, which we least bother. So why there's a compromised gut and you are adding a bad microbiomes. So symptoms increase automatically. Already it is bad. Lungs, similarly, breathing programs are very important. As I told you, you just keep yourself with the right breathing programs. Your sharing force of breathing itself will increase platelets and heal your lung with elasticity.
Right.
So as I told you, if you can work on that, so a lot of the diseases we can prevent or symptoms we can make minimum. And then add the new molecules, as I said, peptides, growth factors, inhalations through the nasal route, inhale. Now, recently launched some high pressure pumps for inhaling growth factors in the lungs. So all the factors has to go and sit in the lung. So avoid respiratory infections. Use still mask with slightest infection. Because you know you are going to have your own problem and others also. Still COVID has not gone 100%, I would say rather. It's not 100%. If you recently see, US was promoting, UK was promoting, Italy was promoting again vaccination, fourth vaccination. Recently. So there are stories will keep on coming. We need to be alert minded. Take the steps which I told you to use it to improve your quality of life.
Right.
Don't take granted your life is a gift. Nobody can touch it. Though life is a gift, I always say life is a gift.
Correct.
And if you get a good gift, please preserve healthy.
So beautifully said, sir. So beautifully said. Sir, you have actually addressed, a lot of, a question for a lot of our audiences with this answer, because, like you said, people started relaxing, but the COVID has not yet relaxed. So I don't think
Not
people
relax.
should also relax. Sir, you spoke about the changes that should happen at an individual level. What, in your opinion, should be the change that should be happening at an institutional level and at a policy making level to prevent these post-COVID sequelae from happening?
In the case of post-COVID sequelae happening, we really need to understand the post-COVID symptomatology. As I told you, not a single organ is left. Not a single organ is left. Some of them feel I was not hospitalized, I don't have any COVID problem. No. Maybe critical organs were not affected. like your lungs are not affected, that doesn't mean your musculoskeletal system is not affected. That doesn't mean your gut was not affected. So keep in mind, keeping this mind, the protocols designed for those diseases in a new aspect, the managements of the hospital, physicians which are dealing has to go back to that, review them properly and change them. And also treatment patterns. Repurposing of molecules is coming as a big story now. Almost every molecule is being repurposed. The reason is that if you want to detect new molecules for the treatment, it will take another 10 years, 15 years to come in the market again. That time we don't have now. That much time we don't have. And that kind of money we cannot put in like $1 billion for one molecule now. So we need to change our approach to research, designing protocols, and therapeutic approach to the patient by changing the modules, protocols, and new repurposed molecules and new platform of regenerative medicine, energy medicine, peptides, which always talk to the people. Please change your approach. Change your communication skills on the disease also. Keep in connected with the newer molecule research so that you can give proper solutions to your patients.
Absolutely, sir. I think you spoke about how at a policy level as well as at an institutional level, the change should come where we need to look at the newer researches, where we need to look at the newer modalities.
So I add, Virench, here one sentence,
Sir, please.
which
Please.
is very powerful message to my colleagues and friends. Please don't be just physicians. Don't read symptoms and write medicines. Time has changed. You have to raise a researcher in you. Ask that researcher a question. Can you go depth of it? Can you find new molecule for this? Can you see what is the disease progress here? What has added? And then you will get the new protocols. So which I do regularly. So
Right.
I tell you, if you want to look into COVID, post-COVID solutions, your standard platform of pharmacological drugs will not work. Ever will not work. Because they have not worked during the COVID. Now they will not work. Only will create the treatment of silent symptom, but the disease or profile of this disease will go away in the body. So you need to go on to regenerative medicine, stem cell technology, growth factors, peptides, and everything as energy medicine. And change the molecular science, and you will get a good solutions for all these diseases. As an institution, we have to change the approach.
I think
So
this is
every
such an
institution, I
important.
would say, Radha Virenchi, have one research department. Ask your doctors to go and work there, basically, and then go ahead.
This is such important things that you said, sir. I think one, you said there should be a researcher inside you. There is a researcher inside you. You need to unleash him. And at the same time, you are saying, even make it a compulsory thing. You have a research department, ask everyone to go and work there.
Yes.
And why not, sir? Because like you said, there's something beyond what we've read in the textbooks, which have been written decades ago. And every day there is a new thing coming up. And why should our doctors not be well equipped with all of that information?
Yes.
And sir, with this, discussion, there was another question that I was having in my mind. Because, like with growing degrees, unfortunately, sometimes an individual's approach is becoming narrower.
Yes.
When I talk to you, it's such an honor and such a happy thing because the dimensions that you talk in medicine are so vast. You talk about different dimensions where most of us are only thinking in that tunnel vision.
Yes.
And especially now when a situation like this is arising, because we were not sure about how many people would get COVID. The numbers, what we thought and what happened, were already shocking. And now all those numbers and most of them are gradually going into a post-COVID sequelae. So at such a point, what is the kind of collaboration healthcare professionals should be having with different specialities? Because we don't have those postings that happen now. As a psychiatry resident, I had only neurology posting. A neurologist is having only probably a psychiatry posting. But now, what are all the specialities that a healthcare professional should be collaborating with?
In fact, it's a very good question for the medical professionals and teaching institutions, particularly teaching institutions. The concept of super specialization, in my opinion, doesn't exist. Reason I'll tell you. The entire body works in a unison. It works on unison. You doesn't mean that you're working on a rectal or anal, doesn't mean the rectum doesn't require a support of anus.
So true.
Understood now? So approach of the teaching and institutional pattern has to change from individual organ to a unison body system. So all the departments should have a integrated discussions so as to get the unison function of the organ. Earlier, I used to feel that there is a specialist for wrist joint. There is a specialist for elbow joint. But they forget elbow and wrist joint are connected to each other for their functions. They forget that. So every part of the body depends on the other body for the function to do it. I'll give you a simple example. You get a myocardial attack, and within a fraction of a second, you take the blood sample and see the mononuclear cell raised from 8 to polymonocyte, which is from 8 to 10,000, will go to 30,000. How fast body responds to the bone marrow? With a fraction of a second, bone marrow will produce that much number of cells. So one has to understand the response of one organ injury effect on the other organ. Got it now? So this unison functional system, we need to come back.
Absolutely,
There is
sir.
a separate specialty for separate cancer, I would say. Basic pathology comes on the cancer stem cells.
True.
And if that is understood, then probably we need to have departmental unison meetings properly, sharing properly, understand the physiological functions from one organ to another organ, how they are affected, what could be the changes taking place, and then come out with the solutions. So we need to change our approach for the management also.
Right. Right. I think wonderfully said, sir. I don't know why the last time this has happened to me, this time also, when I'm talking to you, you are actually motivating me to do some more work than the regular kind of work that I do, because your vast knowledge actually makes me feel, a little belittled about myself because we believe we know a lot, but there is so much more happening, and that passion, that zeal inside you that is making you talk all of this clearly speaks about the kind of time you dedicate for all of this. And that's great work, sir. That's firstly great work. Thank you so much, sir. We would like to hear from you some of your experiences in regards to this post-COVID complications. You did share one in the beginning, but some specific cases that you remember, that you felt that okay, this was difficult.
Lung fibrosis was a big challenge for me. One, brain clouding and myalgic pains. These were three. And one of my, which is a patented subject, bone necrosis, hip joint necrosis, knee joint necrosis. These are the four type of works, of which bony injuries post-COVID, particularly leading to avascularity, I have a patent developed. Bone and bone marrow are one part of the one, are part of one single organ, and I could develop the technology in which I claim every necrosis caused by the COVID can be treated without surgical intervention. So that patent is approved now. And I have done a clinical trial on this work. Is my biggest memory of work. Around 1,500 hip joints I have saved in last 1.5 years from going into necrosis and
Wow.
changing the hip joints in the young generation. It's a big job. So I assure my patient, same joint lifetime, no change. It's a guarantee. Lung fibrosis. Please don't die with the lung fibrosis. If lung can induce because of inflammatory fibrosis, lung can also reverse the inflammation and fibrosis.
Beautiful, sir.
Myalgia, chronic inflammation in the bone, muscles because of vasculitis, completely can be reversed. So I remember some of my patients were day and night taking steroid and painkillers, managing the pain of the muscles. No more muscle pain now. Happy living life, no disease. So there are certain these kind of patients are big in my memory. And as the new symptoms come, new case come, I work on a lot of research work. What is a pathology physiological change? And I write a new protocol, design a new system of the treatment, and bring solution to this kind of problems. So I got a lot of these kind of patients.
Thank you, sir. Thank you so much for sharing your value.
I did. 56 minutes.
I'm so sorry. I'm so sorry. I lost you for a second, sir.
No
I'm so
problem.
sorry. Sir, I would like to understand now with the increase in these conditions that we are seeing right now, especially in regards to post-COVID, uh, what does future hold for us? How is everything? How is all of this going to be evolving? What is it evolving into? And are the healthcare is the healthcare industry ready for something like this? Are they even prepared for something like this?
Yeah, very it's a futuristic question, but let me tell you, getting well prepared. Well prepared. People research, people medical fraternity, people regulatory, people bureaucrats, and who needs the blessing from politicians and industry to put into new research things. Any research is not an easy job. It requires a blessing from the politicians, bureaucrats, money from the health industry, and dedicated researchers and doctors who want to work on that. So the health industry is well preparing to tackle these kind of symptoms now. Only thing, education is lacking, approach is lacking. So we need to improve educational systems, communications to the medical fraternity, repeated this kind of programs, understand what are the new concepts of disease are coming, how to tackle them, and probably world is getting ready for this. I believe world is getting ready for this, and we are part of the system. We have to be part of the system, and we have to contribute our efforts to make things more better and change the human mankind life in the future with such deadly diseases. I think we are preparing very well.
That's a very positive answer you have given us, sir, and that surely gives us a lot of hope that we're all in great hands, and we know the kind of work the health fraternity has specially done during COVID, and it is so optimistic and positive for all of us to hear from someone like you that yes, the world is preparing for something like this. uh, Sir, before we end the show, I would request you to please share some information about the kind of work that's happening at your lab, because everyone's wanting to know what's actually happening there. Uh, we don't know if people are allowed to come work under you, intern under you, but many might not get an opportunity. So we would like to really know the kind of work. And the second thing is, I would want you to end it with a note to all our audiences, sir, about the post-COVID complications. You've spoken vastly, but your final words to medical professionals and our non-medical audiences.
Very good. I'll tell you, Renchi. The work which I'm doing, I want to live the life of another 100, 150 years, not physically, through my work.
Wow.
Through my work. This is my basic philosophy. Second, always give and want to give to the community, to the world, if I can change life of the people around me. That is a philosophy which I practice in my clinical side. I have developed a tissue culture facility of around 5,000 square foot, where various different research projects I keep on doing. One of them, the best one, is decellularization of the organs from a swine, which is 80% matching genetic code to the human gene, and developing in vitro organs to replace the failing organs in the body. This is one project I'm doing. Second, using a battery is low. Please, can you work here? This is most important. I prepare extracellular matrix, make their hydrogels, make their liposomes to target the organs properly. And all the repairing the body is best done by ECMs, not by the cells. So I work on extracellular matrix from various organs of a human and swine and zebrafish, and try to work up them unmet needs in the repairing. In infertility, I work on thin endometrium, Asherman syndrome, PCOS, PCOD, to regenerate the ovaries and endometrial linings. And most important, I deal immune systems which are responsible for unmet causes of infertility. Today, even if you go IVF, 70% there are no causes explained and they fail. So I bring it to 10% that. I see that immune system changes, your endometrium comes, your ovary starts working, all that I work it. I work on certain dogmas which were taught to us in a fixed ovulation pull in the body. I don't say it is true. I say a woman at 60 years can go back to the same ovulation like at 30 years of age. I work on technology of neuroplasticity. Any kind of psychiatric disease in the world, any kind of neurological disease in the world, whether genetic or not, neuroplasticity is existing. How to do it? A very important part. How to use electronic, how to use electric, how to use magnetic, how to use high pressure waves to change the microenvironment of the brain and target those parts of the brain which are not functioning properly, and you get the results in days, not in months or years. You can withdraw all the medicines and he will be normal. So you can change the secretomes of synaptic connections. You can increase the synaptic connections. You can decrease the synaptic connections. You can make the new synaptic connections so as you can bring the new learning processes in the body. Then diseases like macular degeneration, retinitis pigmentosa, where world says no solution. So I have developed technologies how to improve the visual acuity, visual field, by using these technologies by called as an microcurrent through transcornea to the retina. Optic nerve damages, damage to the ocular area of the brain, tinnitus, frozen shoulders, migraine. I work such a beautiful 2 minutes and your migraine is permanently gone, whether it's a vascular or with a neurological migraine. Whether it's a tinnitus related to the brain where the cells are barking each other because of the inflammatory milieu, that can be changed. Hip joints, that's a big project which I'm working. lung fibrosis, which I'm working at my place very much. Then I'm dealing with new technology at my lab, which will be shocking to you. Muscular dystrophies. I develop the myofibers in the lab, myofibers, complete multinucleated myofibers, convert them to myofibril sheets, patch up the muscle, which is atrophic, it will grow, and the muscle will have a strength back to normal.
Wow.
So things are changing very fast.
Right.
So I work on a lot of these kind of technologies which change the human life. That's the reason I said now, I want to live 150 years ahead, even if I die today, changing the people's life. So there are a lot of things happening on visual problems, nasal problems, hearing problems, neurological problems, psychiatric problems, gastric problems, even Herpes disease problems, muscle atrophies, post-polio syndromes, transverse maladies. Then you can say Burger disease of the leg, where we are working on tissue nanotransfection, changing the somatic cells of the skin, somatic fibers of the skin fibroblast into vasculogenic fibroblast, neurogenic fibroblast, or even beta cells in the skin to treat the diabetes. Change the microbes of the intestine, complete from unhealthy microbes like Clostridium, Klebsiella, bring into good microbacteriums like Streptococci, Bifidobacilli, Lactobacilli, so that the microenvironment changes, put the butyrate layer in the intestine so the bad proteins are not absorbed from the autoimmune profile will change completely. So all autoimmune diseases can be treated successfully without any methotrexate steroid, without any myophenolates. So all these are happening at my lab.
Thank you. Thank you so much, sir. I think this is great information that you've given us, and it really makes us feel proud to be in the same fraternity that you are. Though we are not doing any of this work, we know someone whom we are very proud of who's doing all this work, and this is immense work. I'm sure everybody listening to this understands the kind of work, the kind of time that you need to be dedicating for something like this. Firstly, thank you so much, sir. But before we end, I would genuinely, ask you again to please give us your, last advice to, healthcare professionals as well as non-medical people watching this show in regards to post-COVID complications.
Very good. To give in few words a small message, which gives a big meaning. Small message which gives big meaning is that my colleagues, please change the approach to the patient because diseases are different, presentations are different, so you become different. You cannot be the same. And to audience who are non-medical fraternity, they should always adopt the changing lifestyles. It's very important for them. As I spoke in details during your question answers, during your questions, which matters a lot. Life doesn't mean is very cheap. It's a big gift nature has given to you. Value it. Things will keep on changing. Science is dynamic. Life is dynamic. What you do today may not be true tomorrow. So please change your approach to the life. Your diets, your sleeping patterns. Don't take granted everything. Nothing happens. Everything happens. Thank you.
Thank you. Thank you so much, sir. Thank you so much for once again giving your valuable time for me and the audiences of our show with a very important topic, the post-COVID complications. Audiences, I hope you all really enjoyed this show, and there is a lot of information that you all have gathered, and I'm very sure about it. Please like, share, and subscribe this video. Share it to as many people as possible, because post-COVID complications is something that most health professionals have not spoken about, have not got an opportunity to speak about. Today, we are very fortunate. We have Dr. Pradeep V Mahajan sir with us, who has spoken so elaborately about the kind of changes that can happen in the entire system. So please do share this video to as many as possible. And thank you so much, sir, once again for coming onto our show and giving us such important information. And we would love to call you back, request you to come down to remove some time for our show with another important topic. Until
Pleasure.
then, thank you so much, and genuinely, this is for you,
Pleasure.
sir. I mean, for
Pleasure.
all the work that you are doing, for all the passion that you have, thank you so very much. And audiences, this is the end of our today's show, and we will come back with another expert the coming weekend. Till then, see you all. Take care of your health. And this is Dr. Virinchi signing off. A healthy dose. Thank you, sir.
Thank you. Thank you. Thank you. Looking forward to meet you again.
Thank you so much, sir.
Pleasure.